AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening, everyone. Happy Thursday. Welcome to You and Your Doctor, sponsored by All County Healthcare. I'm your host, Dawn Graubert. All County Healthcare is a Medicare certified home health agency serving Dade, Broward, and Palm Beach County. You can give them a call at 954-717-7027 or info@allcountyhealthcare.com. Tonight, I'm excited. We have Ed Salazar joining us. Ed is a highly experienced registered respiratory therapist and clinical specialist with over 40 years of dedicated service in South Florida's Tri-County area. Throughout his career, Ed has remained committed to advancing respiratory care and improving the quality of life for patients living with chronic lung conditions. At All County Healthcare, Ed leads the development and implementation of a specialized pulmonary hygiene program, training nurses and healthcare professionals in advanced respiratory therapy. He oversees the organization's exclusive pulmonary hygiene team, delivering innovative, patient-centered care directly in the home setting. Ed specializes in IPV, intrapulmonary percussive ventilation, and FDA-approved therapy designed to assist patients with chronic lung disease by improving airway clearance and reducing hospital readmissions. His expertise also spans a wide range of respiratory services, including airway clearance therapy, oxygen therapy education, ventilator management, tracheostomy care, and comprehensive patient and caregiver training. His work plays a vital role in bridging the gap between hospital care and home health, ensuring patients receive high-quality, life-enhancing treatment in the comfort of their own homes. Wow. Wow, Ed. With over 40 years experience, I think it's just a pleasure to have you join us.
Who wrote that?
Pretty impressive, right?
I think, did my mom send that?
I'm so glad you're here with us. Thank you for joining us.
Well, it's my pleasure, always.
You have, been the face and the voice of All County and lung care, respiratory care for as many years that I've known you, and so many years you've been with All County.
How many years have we been doing this?
How many years, Fred, have you guys been together? 8 years?
8 years. Seems like just yesterday.
Well, welcome to the show. I think I know everyone's going to really enjoy hearing it firsthand from you. What even got you into respiratory therapy?
Well, actually, I initially wanted to be a physical therapist. I was living in Michigan, and the college kids all got laid off from the factories one summer, so I thought I'd go to the hospital and see what I could get there. And I got a job as an orderly. Anybody remember what an orderly is?
Kind of like a transporter?
An orderly is to do whatever the nurses don't want to do. And I got approached by a fellow who said, how would you like to specialize in oxygen and aerosol therapies? And I said, does it pay more? He said, yeah, 50 cents an hour more.
Wow.
I'm in.
Wow.
And I liked it. I liked the work. We didn't have nearly the technology that we have now, but I felt good about doing it, and I started looking into education. And I found out that there was an accredited school in Fort Lauderdale, Florida.
Wow.
I remember I was in Michigan. So I came down here for spring break and took a look at the school, and I was sold. It turned out that I had an aptitude for it. I enjoyed the work a lot. By the time I graduated from Broward College, I was on graduation. I was offered a position as an assistant director at a new hospital in Lauderdale Lakes. It's FMC now, but at the time it was Lauderdale Lakes Medical Center.
Wow.
And a couple years after that, Northridge opened up, and I got the job as the technical director of the cardiopulmonary services there.
What does pulmonary services entail? Because people think albuterol or nebulizer or percussive therapy, like manual percussive therapy. What do you do within the respiratory realm?
Well, anything and everything that has to do with improving ventilation, maximizing cardiopulmonary efficiency, cardiac output as well, and treating any sort of lung disorder that manifests itself in shortness of breath or, in some cases, cardiac arrest.
Well, let's talk about how it goes together. Cardiopulmonary, right? You're talking both. Your heart and your lungs play vital between both.
Right. The job of the heart is to pump the blood, right? And so it's got to pump the blood through the lungs. In the lungs, it picks up oxygen. It releases the carbon dioxide, which is a byproduct of metabolism. And the oxygenated blood goes out to the body and then comes back again and makes the trip. If anything interferes with that interface in the capillary bed and the little air sacs, that's where the gas exchange takes place. And anything that interferes with that process is going to cause untoward effects in the patients, the shortness of breath and things like that. What we do with IPV therapy, well, let me explain a little bit about what IPV therapy is just a form of high frequency ventilation. And it's nothing new. It's been around for 40 years at least. But because the technology was kind of cumbersome at the time, it was relegated primarily to critical care situations. Well, the technology improved, and they were able to create platforms that were realistic to be used other than the ICU. So it started working in different areas of the hospital. Someone had the idea that if it works that well with the sickest of lungs, it would work pretty good with lower acuity lungs as well.
Is it invasive, non-invasive?
Completely non-invasive.
How does it work?
You have a nebulizer. Most people are familiar with handheld nebulizers, right? But this nebulizer has a tubular cylinder that has a spring-loaded piston in it, that when pressure is applied to that spring-loaded piston, it oscillates back and forth. Then you have a mechanism to control the frequency with which it oscillates and with the force with which it oscillates. And this creates a pulsatile flow through the lungs. And this is the key to why it's so effective and why it's so safe. And that's the big thing in home care. It's got to be safe.
Safety, right?
Right. So you've got these pulsations of air, and they're happening at frequencies. In the case of the home care machines, that we work with a range from 300 to 600 cycles per minute. And you have frequency, and then you have amplitude, and the two work together to get the maximum penetration through the lungs. And if you have an airway, even a very, very tiny airway that gets plugged with mucus or what else, if these little boluses of air keep hitting it, now these boluses of air are going to take the path of least resistance. They're going to go right down the center of the airway. And if they reach any kind of obstruction, they'll keep impacting it until they breach it and get behind it down to the terminal airway where the air sacs are. Well, now the air's got to come out. So if the air's got to come out at the same time it's going in, now the air is going to come out around the wall of the airway. So it's going in down the center of the airway, and it's coming out around the wall of the airway. And it's coming out in a spiraling motion, and anything that's attached to the airway is going to come up with it.
Mucus and phlegm and everything that's stuck in it.
Exactly.
So it's pushing in the air and it's sucking out everything that shouldn't be there.
So if you have a situation like a pneumonia or something called atelectasis, where those little air sacs are collapsed, you're going to recruit that lost lung volume. You're going to reinflate those alveoli, and anything that's impeding the flow is going to be washed out with the extra. So you're getting a lung recruitment and airway clearance simultaneously, which is going to improve oxygenation, which is going to make your patient better.
And it's just with air.
Just air.
We're not putting medication in this.
Oh,
like a nebulizer.
no. You use aerosols.
You are, okay.
It does have an aerosol built into it, because when you're moving that, there isn't a lot of pressure, which is what makes it safe. The pressures are very, very low, but there's a lot of airflow. And a lot of airflow, if it were to be dry, it would be counterproductive, because then you're gonna, it's called to desiccate the airways. You'd be taking the moisture out of the airway, which is gonna leave the secretions.
So you got to put something
Right,
in.
right. So you got to humidify it as well.
In All County, I know we talked that All County is the only home health care agency that is doing this. You tell me in the United States, so he tell her.
Well,
or at least in
I'm
Florida.
absolutely certain in Florida, but I've not heard of another program in the United States. And I know that because before I started working with All County, I was a distributor for the manufacturer of the equipment. And my wife, Carol, she was the director of nurses for All County. And she heard me moaning and complaining about why I couldn't get anybody to listen to me outside of the hospital, because I thought this would be so good in clinics. This would be so, it had already proved itself with cystic fibrosis kids. It was nationally accepted as a preferred mode of treatment for cystic fibrosis kids. So the big obstacle was the cost of the equipment and who was going to deliver the therapy. So, you know, we're floating around the pool, sipping on some rum runners, and she says, well, could you teach nurses to do it? I said, well, of course, you could teach nurses to do this. And so she said, well, let's go talk to Lou. Lou Biazzi being the original founder of All County Healthcare. And we told Lou what we wanted to do, and he said, well, will this help our patients? I said, it will absolutely help any patient with any kind of chronic lung condition. And that doesn't, you know, COPD remains one of the top 3 leading causes of readmissions into hospitals post-exacerbation. But also neuromuscular diseases, you know, where people start having reduced mobility, they can't breathe, they can't sigh, they can't cough as well as they used to be able to. You know, ALS patients, muscular dystrophy patients. You know, it's a good way for them also to maximize their ventilation. So he said, well, can we make any money doing this? Well, no. He said, okay, well, let's buy one machine and we'll give it a try. And that's how it started. The popularity of the therapy caught on. The efficacy proved itself right away. In the first year that we were using it, Carol kept records for the purposes of our committee meetings. She had to show evidence of why we were involved in this program. And now this was 2012. And at that time, in the state of Florida, you can go to ACA. And through ACA, you can get records on these readmission rates and for different diseases and things like that. And at that time, in 2012, the readmission rate for exacerbation of COPD was like 9% in 15 days post-discharge. 30 days post-discharge, the readmission rate was like 20%. Ooh. And that's what Medicare is so upset about.
Sure, because every time they readmit, you have to go back and the billing, and it's billing Medicare, and it's back and forth. The patient originally should have been taken care of in the first place. So and we'll talk about on the other side of commercial break. So it's the bridge between hospital care and home care, which is why home health is so critical to keep them back from the readmission.
Yeah, healthcare people, hospital people, discharge planners, they're always talking about transitional care. This is genuine transitional care.
All right, we're going to take a quick commercial break. When we come back, we're going to talk about transitional care and why you should contact All County Healthcare. More to come on the other side of this commercial break, and we'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And welcome back to You and Your Doctor, sponsored by All County Healthcare. All County Healthcare is a Medicare certified home health agency serving Dade, Broward, and Palm Beach County. Give them a call, take a pen and paper, write this number down, 954-717-7027, or you can email them at info@allcountyhealthcare.com, and of course their website, allcountyhealthcare.com. Tonight we're here with Ed Salazar, who is the leading respiratory therapist in training of all of the nurses and the staff at All County for respiratory care. And today we're talking about IPV treatment for not only COPD, but that you're saying is one of the most highest readmission rates. And by doing this transitional care from hospital to home is what's so critical in keeping patients from the readmit back to the hospital.
Exactly. If a patient has, it's called an exacerbation. You know, you have a COPD patient, for instance, that starts getting progressively worse, and then their shortness of breath gets worse, they get more and more congested, they can't cough well enough to clear it out, they go into the hospital uses their advanced techniques to clean them up, you know, got them stable, and they discharge them. Well, if there's no transitional care at home, which can do the same thing that he received in the hospital, then in these COPD patients and other patients with chronic lung diseases that are going to decline, it's inevitable. You know, they're going to get to the point where they have to go back into the hospital.
Now, will this lung care, the IPV therapy, help with congestive heart failure? If you're clearing the gunk, for lack of a better word, out of the lungs, will it help the heart pump better since the heart is helping clear the lungs?
Well, that's a little bit different. Congestive heart failure is usually because the pump isn't, the heart, the pump isn't pumping as well as it should. Pumps. Then fluid starts backing up into the lungs. So it's not phlegm and with congestive heart failure, it's fluid. And the IPV, you know, will help mobilize that fluid, but it won't be a sustained improvement if they don't correct the pump problem. Right.
And transitional, the care, we're talking about the price, which is why it's so difficult for other agencies to help offset it, because you accept Medicare, and I know we wanted to touch base on this, why it's so important with Medicare versus a Medicare Advantage program to work with All County because of the IPV.
Well, before I started working with All County, I went to other home health agencies, and I went to home health agencies that did non-traditional Medicare, you know. And the problem there was that there were, for all lack of a better word, caps on the amount of care that they could receive. And many, many times they would be relegated to, say, 5 visits is the most the nurse could go out there. Well, that's simply not adequate to achieve the desired benefit with the IPV therapy. So they would look at it, and they would sometimes, none of them had a respiratory therapist on staff, but a lot of them had physical therapists. So they would say, well, talk to our physical therapist. And I'd explain it to the physical therapist, and they said, this makes sense. I'm sure this would help our patients.
How many treatments do you typically need, or is it continuous treatments?
Well, that's another thing about All County that I give them a lot of credit for. We usually see the patient at least 16 times, for a moderate to high acuity.
Is it 3 times a week? Is it twice a week? Once a week for 16 weeks?
The protocol that has worked very, very well for us is that we'll see them every day for the first week.
Wow.
And depending on patient compliance too. They've got to make themselves available. But we'll try to see them every day for a week, and then, or as they feel improvement. And then we'll see them on a PRN basis as needed. And how do they know if they need it? Well, we've given them a peak flow meter, and we've given them a pulse oximeter. With the peak flow meter, once they completed the first cycle of the therapy, they'll blow into it and they'll see what kind of flow rates they can generate.
And those are not easy.
Yeah, you've done it?
I can tell you, even at my age, those aren't easy to do.
Well, the nurses do a great job of educating the patients on how to do it properly so they can do it themselves. And we show them that if they start to see a decline in the amount of air the flow rate they can generate, then call us and we'll come back and we'll treat them again.
And there's no cap on straight Medicare coverage for this?
Well, the way straight Medicare works is, and again, I know I keep saying, how exceptional All County is, but what Medicare does is they'll give you X amount of dollars for a diagnosis. So let's say the patient qualifies for a $4,000 payment for a 60-day admission.
Okay.
And so you've got $4,000 to use to treat. So when we see the patients on the average of 16 times in that 60-day period, the agency's not making much money.
Yeah, not out of $4,000.
No, but again, All County, they didn't care, and what they look at it is just added value to their agency because they do everything else as well. They do the wound care, they do the diabetic care, they do all of those things.
So a nurse actually comes out every day for the first week. You're not adding an aid.
Well,
you're not doing it yourself. The nurse comes out.
It may not be every day the first week. That's what we go for.
Okay.
But if the patients, do, and sometimes, after 2 or 3 patients, we see dramatic improvement.
That's amazing.
Yeah, and well, I could talk a long time about that. What we've shown that as far as the readmission rates, in the first 2 years that we had this program running, and by that time Lou had purchased 5 machines, and they were all busy. All those machines were busy. The agency's readmission rate was 5% for 12 months, not 30 days.
Wow.
Right. And I kind of chided my wife about, Carol, about, she included some people that, had lung cancer. And I said, those should be outliers. She said, no, we got to include them in the cohort. So I think our statistics would have been even better.
That's incredible.
But 5% is amazing,
Great. And I know we only have 3 minutes left, but before that, we also wanted to talk about All County as their nurse registry. There's 2 sides of All County.
Right.
There's a home health agency, 954-717-7027, but there's also the All County staffing, which is the nurse registry.
The beautiful thing about this is, another unique thing about All County is it's a Medicare home health agency. They only work with patients that are covered by traditional Medicare, but they're a tri-county agency. So they're licensed in Dade, Broward, and Palm Beach. And their sister company, the nurse registry, this can, again, continuation of care. If they have a patient that once the All County has completed their cycle with them, that they want to have a nurse's aide, they want help with light housekeeping, they want transportation, they want a nurse just to come and see them, once in a while. The nursing registry can provide that, and that again can be applied in all 3 counties.
And that's covered often either by Medicare for a certain amount of visits, right? You have to check with the Medicare in your plan, but there's a certain amount of times that a nurse can come, I guess, based on the diagnosis of what it is.
Right. Yeah, you always got to check with your insurance, but many times, some of these things will have to be out of pocket, and the registry program is very, very, very reasonable.
And it's so, I say this all the time, All County took care of my mom when she had her bypass. And it was just a huge lifesaver. I mean, everything from walking and ADLs to bathing to toileting to even just a companion to move through it. And I know they offer psychiatric help and emotional support and support. There's so many things that All County does that's more than just a nurse or an aide or the IPV. Altogether, they're a totally comprehensive agency.
Yep, you know what I always tell when we go and talk to a doctor about the program, I said, look, send us your worst patient. If we don't do exactly what we say we can do, don't call us back. And we've done very, very well.
Well, always a pleasure. All right, before we wrap up, one fun fact about you. Fun
One-
fact. A fun fact. Yeah, and you said.
No. No. I've recently become a boat owner.
Oh, congratulations.
Maybe. And this is part of my retirement plan.
All right, very nice. And tonight you're heading out to do some choir at church.
It's Holy Thursday.
It's Holy Thursday.
Yeah, and so we have the choir is going to be singing at the Holy Thursday services. I've been a member of the St. Andrew choir for 3 or 4 years now. I enjoy it a lot.
It's always nice to see the other side of the people we get to chat with on Thursday nights because everyone works really hard. All County has incredible doctors and a whole
We have
team
some
around
great
them.
nurses.
But to see really what it's like on the inside of what you're doing outside of work and relaxing a little bit, R&R, and being there for Holy Week.
I wish that a new referral source, a new doctor, would come to our Christmas party.
Okay, something to work on with a few
Yeah.
months. Thank you so much for joining us. As always, you can reach All County at info@allcountyhealthcare.com or their website, allcountyhealthcare.com. Give them a call serving the Tri-County area, 954-717-7027. Wishing you all a happy Passover if you celebrate, a happy Holy Thursday, Good Friday, happy Easter, it's Holy Week. Spend some time with those that you love, and we will see you next week. Have a great night, everyone.